This film is to show how to record and code observations of nursing personnel activities in hospitals. The technique is described in recent studies developed by the Public Health Service. The study method has been published in the manual, How to Study Nursing Activities in a Patient Unit. Other manuals, How to Study Supervisor Activities in a Hospital Nursing Service, and How to Study the Nursing Service of an Outpatient Department, describe adaptations of this method of observation. The observer is the key figure in all studies of nursing activities. She wears a white coat over her street clothes. She does not wear a nurse's uniform or cap, although she is one of the nurses selected from among the nursing personnel of the hospital. She is not dressed as a nurse so that patients won't expect her to provide care. The observer carries a pencil and a clipboard to which are attached a watch and several blank observer's record forms. Here is the unit in which the observations are to be made, and these are the people our observer will study. We are going to demonstrate the work sampling method of observation. We do not watch each member of the nursing staff constantly, but look to see what she is doing during a selected interval of time. In this study, the interval is 15 minutes. The personnel who are to be observed are tagged with cards which identify them according to their job title. RN for professional nurse, HN for head nurse, and so on. When the unit employs more than one person in each category of nursing service, aides, practical nurses, professional nurses, for example, the tags are numbered to help the observer recognize which individual she is observing. All members of the nursing service in the study unit are tagged in this way. For the purpose of this film, our observer will locate and record the activities of each staff member once every 15 minutes. The head nurse, the professional nurse. In this study, there are two, RN1 and RN2, the student nurse, the practical nurse. If more than one practical nurse is employed on the unit, they would be tagged PN1, PN2, and so on. Then the nursing aide is observed. The clerk and any other personnel on the unit employed by nursing service. The observer must find each person assigned to nursing service on the study unit. She must observe the activity being performed at that time. Then she records it. If there are more than 12 persons on duty at any time during the study period, 2 observers will have to be assigned. 4 forms are needed for each hour of observation. 1 form for every 15 minutes. Here we see a simplified record. Before the observation starts, the observer should fill in the headings on all the forms she is going to use. Begin with the name of the unit, then the name of the observer and the date. Then insert the time of day when the observations are to be made. Number the page. Now list in column B on each form the code titles of the personnel to be observed on this unit. The symbols HN, RN, PN, SN, and so forth are what we call the code titles for each category of nursing personnel. Now fill in column A, the exact time when the study is to begin. Remember, each member of the nursing staff must be observed once every 15 minutes. Now we are ready to begin. The observer does not try to locate the staff in the order listed on the forms. She observes the person nearest her and records exactly what is happening in column E on the form. The observer sees an aide wheeling a patient down the hall. She asks the aide where she is going and why. The aide replies, "I'm taking the patient to X-ray." The observer immediately records the activity. Otherwise, she might forget it in the rush of each 15-minute observation period. This activity is recorded in column E as taking patient to X-ray. The activity observed must be written clearly and concisely so that any reader will know what happened, to whom and with whom. Then it is coded according to area in column C. Taking patient to X-ray is an activity in the presence of a patient, but it is not a treatment. Therefore, it is recorded in column C as code 12, which you will recall from your list of code references is other direct activities. The activity is now recorded according to the level of skill which is required to perform it. Accompanying a patient to X-ray or to other departments of the hospital does not usually require nursing aid skills. So, enter MES, messenger, in column D. Here is an example of another activity observed. The head nurse is giving a student nurse instructions regarding the care of a specific patient. Write this activity in column E. Then, in column C, area, code the activity as 13 because it is exchange of information about a patient. Next, insert in column D the level of the activity being performed. The level is HN, as this activity of the head nurse is at her own level of responsibility. Now let's assume we're recording the same activity, but in relation to the student nurse who is receiving the instructions. The activity is filled in column E, receiving assignment from head nurse. Then insert SN in column D, as this is a proper level of activity for a student nurse. In column C, area, write 13 again, as this is also an exchange of information about the patient. Our next example shows a clerk making out medicine cards from the order book. Write this activity in column E. In column C, insert 14, indirect care. Now code the activity by level, CL for clerk. Copying information or other data involves clerical skills. It is not a nursing activity. The observer next sees the practical nurse going into the corridor and asks her where she is going. The practical nurse replies, "I'm going to ask the head nurse how to prepare an oxygen tent for use on the unit." This activity will be filled in column E. Then it is to be coded in column C. This code area is 21, in-service development. This is the chosen code because the observer understands that what the practical nurse is about to do is something which will improve her skill in caring for patients. The level, which is PN, is then inserted in column D. The practical nurse is functioning at her level when receiving instructions from the head nurse. Here is our last example. The observer sees RN1 carrying a treatment tray as she leaves a patient. She has just changed a dressing. The activity is part of the care given, so it is recorded in column E as changing patient's dressing. It is coded by area in column C as 11, giving care, and coded by level, RN, in column D. Now let's review. The important steps to remember are: make only one observation of each person every 15 minutes. Don't try to locate the staff in the order listed, but just as you happen to find them. First, write the activity clearly and concisely. Then code it by area, then by level. The observer now waits until the next 15-minute interval is to begin before making any additional observations. Because her 15 minutes aren't up, she relaxes.
This is the second part of a two-part film demonstrating observation techniques described in the Division of Nursing Resources Manual, How to Study Nursing Activities in a Patient Unit. In part one, we observed the activities of various kinds of nursing personnel. We recorded our observations on the observer's record sheet, entering the activity clearly and concisely, coding it by area and by level, and making only one observation of each person every 15 minutes. We will continue to use the same observation method and the same 15-minute observation period in this film. However, this time we will talk about activities which the observer may find confusing or difficult to code because what the person observed is doing is not evident. Several persons are observed simultaneously. The activity observed apparently is not at the level of the person performing it. One person is performing two activities at the same time. Or perhaps the activity involves a telephone conversation, with the observer hearing only part of the discussion. Let us first take a situation where the purpose of an activity by a member of the nursing staff is not obvious. To record the activity as walking down hall would not really identify the activity. What the observer must learn is intent, why this activity is being performed. What are you doing? The observer asks. Coming from pharmacy, the nurse might reply. This answer is still inadequate. Why did you go to pharmacy? To get unit drugs. The observer now has enough information to record the activity. She enters 30 after RN in the area column because the activity is housekeeping. And even though the person observed is a nurse carrying medicines, the level of the activity is messenger. A student nurse walking down the hall volunteers, "I'm answering the light in 407. This activity is indirect care. The observer codes it as Area 14. And under level enters SN. What are you doing? The observer asks the practical nurse. I'm waiting for the diet trays to arrive from the kitchen. This, again, is indirect care. It is at dietary level. A student nurse tells the observer, "I'm waiting to demonstrate that I know how to do an irrigation." This is coded Area 22, Student Education. The level is SN. The head nurse seems to be preoccupied. The observer asks, "What are you thinking about?" The head nurse answers that she is worried about a patient's reaction to medication. This is indirect care. And since reaction to medicine is properly a head nurse concern, it is coded HN in the level column. Suppose the head nurse had answered, "I was thinking about a movie I saw last night." This would be a strictly personal thought, having no bearing on the work situation, and would be so coded. Often several people are observed simultaneously. The observer records each individual's activity separately. Here, the RN is assigning duties to a student nurse and a nursing aide. The observer records the RN's activity as exchange of information about patient. The student nurse asks, "Should I give the treatment before or after bathing the patient?" The observer records this as asking how to assure best results from treatment. She codes it Area 22 because it contributes to the educational development of the student. The nursing aide has been listening to this exchange of information. Her activity is coded Area 13 at NA level. When an activity is not at the level of the person performing it, the observer must learn the reason behind it. The head nurse is arranging flowers at a patient's bedside. As she leaves the patient's room, the observer questions her. "I hate to see flowers just stuck in a vase." In this instance, the activity is housekeeping, even though it was performed by a head nurse. Had she replied, "I wanted to see how the patient was doing," the intention would have been entirely different. The level then would be HN. Whenever two activities are being performed at the same time by one person, the observer must decide which is more important. An RN is passing diet trays. She pauses when a patient asks her about his diet. Explaining dietary needs to a patient is an activity that outranks the passing of trays. In such a situation, the observer records the higher level activity. And instead of writing D for dietary, under level, she writes RN. As this activity is not a specific treatment, it is coded in Area 12. If two activities being performed by the same person are at equal level, as when an RN prepares a piece of equipment for a treatment and at the same time demonstrates this procedure to a student nurse, the observer lists both activities. She leaves the area column blank until she can ask the study director which activity is more important for the purpose of this study. Telephone conversations present a special problem because the observer cannot hear everything that is said. The observer waits until the call has been completed and then asks her questions. She must learn the purpose and content of the conversation and to whom the nurse was speaking. Only then can she code the area and level of the activity accurately. Many other situations are confusing or difficult to code. Mealtime is an example. If a full-time nurse takes more time than authorized for meals, the excess time is recorded personal. Mealtime for part-time employees is always coded personal. Sometimes a nurse cannot be located within the observation period. The observer simply waits until the next time she sees her, then asks her what she was doing and enters the activity accordingly. You have seen examples of typical problems which you, as an observer, will encounter. Other situations will undoubtedly arise. Their solution and the success of your nursing activity study will depend upon your ability to function as a keen and interested observer.